Hi everybody, welcome to UroChannel. Some of you commented on my video about penile enlargement that I didn't mention vacuum devices, which is true. For this reason, here's my opinion about vacuum pumps. My name is Stefan Buntrock, I'm a urologist and sexologist. My video on penile lengthening has induced some interest regarding traction devices. But what about vacuum pumps was one of the repeatedly asked questions. Yes, it's true, vacuum devices also stretch the penis. And we know from decades of experience that the body reacts to permanent traction by adapting to it in terms of growth. Skin expanders in plastic surgery or the effects of traction in bone growth in orthopedics may serve as examples. On a cellular level, permanent traction initiates adaptation processes with cell proliferation and expansion of the tissues. So would it work at the penis too? Most probably yes, although we don't have much scientific data on this. I recently uploaded a video about stretching devices. I will also put a link to it in the description. With repeated traction over long periods of time, it can be expected to gain around 1 to 2 centimeters, which is approximately 0.7 inches. But this comes at an effort that requires quite some discipline over several months, as traction will have to be applied for at least 3 hours a day, better 6 to 8 hours every day. And this is the reason I didn't talk so much about vacuum devices in my penile elongation video. Vacuum pumps do an excellent job when it comes to erectile dysfunction, but in my opinion, they have little if no use at all for penile elongation purposes. Initially, I prescribed them in Peyronie's disease, where penile shortening is part of the picture. With this condition, penile stretching within a multimodal approach is something I think is one of the cornerstones. The problem with vacuum devices is, though, they can only be used for a very limited amount of time. Heavy users among my patients develop chronic signs of congestion, with the penis taking on a purplish-blue discoloration. Plus, I don't think they're effective for this purpose, simply because they can't be used long enough. In Peyronie's disease, I've shifted towards penile extenders exclusively, so this is the reason I don't favor them when it comes to penile lengthening purposes. It is not advisable to put a vacuum on a penis over several hours a day. Okay, that was kind of euphemistic. Let me put it this way. Don't do it. Don't use vacuum pumps for longer than 30 minutes at a time. Otherwise, you might get your penis damaged. I went through the available literature and only found one study with a research question whether vacuum pumps are effective for penile lengthening. And the results were not convincing. One could argue that it was a very small study, no control group, and the device was used only 3 times per week for 20 minutes each time, which is definitely not comparable with the studies done on penile extenders. In lack of more studies, one could say, we don't know, maybe vacuum pumps work nevertheless. But since time is of the essence, I don't recommend them anyway for this specific purpose. Hope that straightens things out for you. Haha. Don't forget to watch my other videos on penile lengthening. If you haven't done so, subscribe for more information to come and stay safe. Bye bye.